Hi, my name is Dr. Jared McDaniel. I am a private practice plastic surgeon with Gallatin Plastic Surgery in Bozeman, Montana. Today I had an interaction with a patient and she suggested that I make a video to describe the process by which we select implants and try to ensure that patients are as happy as possible with their results. Breast augmentation is a very commonly performed operation in the United States and certainly in my practice as well. There are technically two different ways to accomplish breast augmentation, with the first and newest version being fat grafting, where fat is removed via liposuction and injected into the breasts, and the second, older and much more reliable method is to use breast implants. Implants come in two major types, saline implants and silicone implants. In the United States, silicone implants are used much more commonly. They have the most medical evidence of any medical device in the world, more research demonstrating their safety and effectiveness compared with any other device. They are very commonly used and very safe and effective.
Breast augmentation has a very high satisfaction rate, as do most of the operations in plastic surgery. It is also one of the consultations that I spend the most time with patients in, so that they have a thorough understanding not only of the operation itself, the process, the recovery, the benefits, and so forth, but also specifically about implants. Implants have a very long history in plastic surgery. In fact, they are the most studied medical device in the world. So we have a lot of information about what they do, what they don't do, the risks, complications that can be associated, and also ways to optimize the patient's appearance. One of the most common concerns that I have from patients at the time of the consultation is about implant sizing. Specifically, patients are oftentimes concerned that they will look too large or feel too unnatural after surgery. As such, we have several ways that we try to mitigate this risk and improve the patient's experience in implant selection.
One of the tools that patients will frequently use to try to determine which implants to select is to bring in photos of other patients that they found on the internet. These may be photos of patients that they like the appearance of, or conversely they may be photos of patients that they don't like the appearance of and they want to avoid that in their particular case. Either one of these categories may be useful, with the caveat that those patients that they're finding online, even if those patients look fairly close to their appearance, may be very different in terms of the quality of their tissue, how much fullness the patient has at the top or the bottom part of their breast, how much drooping, where the implant is placed, etc. So therefore it's important to keep in mind that just because the patient got a similar type of implant that you are considering does not necessarily mean that your results are going to look the same way in terms of projection or natural versus artificial appearance after surgery. During a patient's consultation, I perform an examination where I take various measurements of the breast as well as test the breast to make sure that there is no evidence of any malignancy or any findings that are concerning and need to be evaluated with imaging prior to the operation. During that process, I evaluate for droopiness, I evaluate for symmetry, and importantly, I also evaluate the width of the base of the patient's breast, what we call the breast base diameter. This is the most important measurement that I take when I am evaluating a patient for implants, because the width of the base of the implant, the bottom sort of circle, if you will, that makes up that diameter, that determines, in combination with the volume that the patient desires, how many cc's or milliliters that they want in that implant to improve their breast size. That determines the projection of the implant. Contrary to popular belief, a patient does not come in and we look at the patient and go, I think that she could use high projection implants, or I think that she would do well with a low projection or moderate projection device. Rather, our measurement of the base diameter plus the patient's desire for a certain breast volume essentially tells us what projection of implant the patient needs that we need to then order to plan to put inside of the patient. Once we've done our examination to establish the measurements of the breast, as well as to make sure that there are no other factors that need to be investigated before surgery, then we have the ability to perform implant sizing. Now, there are a few different ways of doing that, and interestingly, the least helpful way is to try to associate the increase in size with a bra cup. Bra cups have no standardization, so if you are measured at 3 different locations, you'll likely be measured in 3 different sizes, depending on the manufacturer of the bra and the model, if you will, of that bra. So therefore, we don't use bra cups very much, although it does give us an indication of the relative increase in your breast size according to your body proportion. It's not very helpful for actually selecting an implant. The 2 most common ways of doing that are either with breast implant sizers or using 3-dimensional computed tomography imaging. So with regards to the first version, using implant sizers, they are simply non-sterile versions of the same implants that we order, placed underneath a t-shirt and sizing bra to give a relative idea of the impact of that implant on the patient with clothing on. Now, it's a little bit deceptive because placing an implant sizer on top of the breast underneath a t-shirt and bra overestimates how much that implant will increase the breast size by about 15%. So for example, if a patient is looking at a 400 cc implant, they like the way that that sizer looks on top of their tissue, that's actually what about a 460 cc implant would be required to use to make that same effect. So it can be a little bit deceptive because people can size at actually a lower size than what they actually want to achieve their goals. The second way to do it is with 3-dimensional imaging. This is primarily what we use in our office. 3D imaging systems such as the Vectra system from Canfield Scientific will produce an approximation, sort of a visual estimation of what that implant will do for the patient, so we can size the patient virtually with different implants in the computer program, and that will give a representation of what that implant will do in terms of the impact for the patient. The downside to using 3-dimensional imaging is the fact that the computer can't always figure out exactly based on the patient's tissue how that will change sort of where the nipple and areola sits and things along that nature, but usually gives a pretty good sort of an estimation of what that will do. Although the process of selecting an implant may seem intimidating, the process usually goes quite smoothly. Patients are able to see the simulation of the implant volume that they've selected on their appearance, either on the computer screen or underneath the sizing t-shirt and bra. Patients are usually very satisfied with the results of surgery in terms of the size of the implants that they have selected. It is very uncommon for patients to come back and wish that they had changed sizes, although it is more common for patients to come back and say that they could have gone a little bit bigger rather than saying that they could have gone a little bit smaller. As part of the implant sizing process, I look at the patient's implant selection and verify that I think that the patient's tissue will be able to accept that implant and that it will accommodate their goals. However, I do not attempt to place an implant that is outside of the range that the patient has selected. So if a patient selects a volume of between 400 and 475 cc's, I will usually place the upper end of that selection, knowing that patients are more likely to pull themselves back a little bit and size lower. But I won't be placing an implant that's 525 cc's or 600 cc's just because I think that that would look better for the patient. Well, that just about does it for today's video on breast implant sizing. Hopefully this has answered some of your questions on selecting the right size of implant to achieve your goals. Please don't hesitate to contact us. We'd love to hear from you. Our phone number is 406-577-2346. You can also contact us at info@gallatinplasticsurgery.com if you'd like to send us an email or visit our website at www.gallatinplasticsurgery.com. Select the Contact Us page, and the form there will help us to get in contact with you. Thanks and have a great day.